Hi,
Okay.
welcome to an NLS scan. This is Jen. She's joining me for a quick 15-minute scan. We're going to go ahead and start off here with a general scan that I do, and we're going to go through my Q cup here. It's going to do flashes of samples across the screen and overlay on top of it energy signatures. The energy signatures correlate with the amount of energy for that segment. So the yellow is the goal that we want to have, the yellow to the orange upright triangles. Once we have those downward facing triangles, then that's an area of active inflammation. When we get to the symbols that show the brown diamonds and the black squares, these are increasing levels of inflammation and low energy in that body are likely starting to cause issues. So we're going through a basic scan of each segment of the body. We can see a variety of overlays here. We saw that was the red blood cells. This is the autonomic nervous system here. And one of the great things about the scan is that we're able to look at layers of the body, whether it's the lymphatic system, the autonomic nervous system, the normal nerves of the back, the muscles, the skeleton system, individual organs, body sections, down to tissues, cells, and DNA. So it really allows for a nice complete assessment. And the scan period here, this is just the initial phase. Once the scan is over, we're going to go and we're going to start assessing the wellness or lack of it in her body. So you probably recognize quite a bit of these scan segments, Jen. You're very health conscious and you have some seriously chronic and severe issues that you deal with your health. And so now that we did the general scan, we're going to do a quick overview. So with this biofield, we see inflammation through the chest and gut area, plus the right shoulder. We see a hypermark here at the head area. And sometimes, even though yellow is our goal, sometimes it can indicate too much energy is in an area trying to deal with a problem. So sometimes you're going to see that with some sort of energy blockage. Here with the head, we see sinus inflammation through here, which is not surprising if we know Jen's medical history. And then here we see throat inflammation, we see lung inflammation, and we see heart inflammation. In this side view here, we see these black squares looping up. This is actually the blood flow line looping up and going through into the heart. We also see an overlayment of a black square and diamonds here in the liver section. We see some here in the thyroid. We see some here in the breast tissue. And then we see some scattered through the exterior muscle and the skeletal area through the thoracic as well. As we go through, we also look at the brain flow. This is actual artery energy through the cerebrum. So we see that we have impedance here, which isn't surprising because we already know that we have blood flow when we trace that up the line through the body screen here. So every time you have a blood flow issue, that's going to be reflected throughout the scans. For instance, here in the blood biochemical homeostasis, where it shows the red and white blood cells, you can see that the red blood cells have those inflammatory markers. As we go directly for a close-in shot of those red blood cells, we can see just how much inflammation and low energy we're having. Also, going back to that blood chemical homeostasis, we see that there's inflammation on some of these white blood cells as well. Depending on which white blood cell, that can indicate allergy or infection, and that's something that we'll be able to dig in deeper and see. Also notice that when you have areas that are having issues, so if you're having heart and lung issues, often you're going to also see that reflected through this autonomic system in that section as well. That's what's great about being able to look at and address multiple layers. Here's the muscle system from the front, has inflammation points, the skeleton as well, connective tissue. And mast cells do become activated with infection and also are drivers for inflammation. So it's not surprising to see those active on her. So now we're going to go ahead and we're going to go into another preset. She specifically has respiratory and immune issues. So we're going to take a quick look at a few scans of hers in this section. And also I'm going to program the machine that when it's scanning, it's going to do one zap of biofeedback frequency to balance out. That way I can kind of watch and see what those tissues do. So I have everything pre-selected. As you can see, I have a very long database going down all the way into DNA. However, we're going to keep this short because it would take almost 2 hours to scan the whole database. So now we're going to go over here and we're going to do a scan with a therapy. So we can see some sinus inflammation, and likely that brain inflammation has to do with that brain blood flow, low energy that we saw on the other screen. And often the right side, I'll see that the right side has more inflammation. That tends to be where we hold a lot of emotional stress too. This is a cross section of the lungs. Here's the tongue. When I'm dealing with the respiratory system, I like to take a little bit of a look around various segments, including the tongue, so we can see any indications of infection. This is a closer view of the sinus area, including extending down into the teeth. So we see some active markers of inflammation with the downward arrows. This is the nasal cavity mucosa. Active inflammation, as well as some diamonds up there in that upper layer. And we can see that they are resolving with the basic biofeedback zap that it's going through. This is the lungs trachea. And a one biofrequency sweep seemed to resolve a good portion of it. If I was to work on this and go more in depth, I would actually be doing scans one at a time, and we would be looking at strengthening percentages. I'll show you a little bit of that on the next screen, but I would rather be able to show you some of the advanced features as well. So we're going through a little bit of balancing through these areas. That cross section shows a little bit of inflammation even on the thyroid. And all of this is really a really safe way to go about examining the body and rebalancing everything. I like working on the mucus gland itself because a lot of times the health of other lung tissues, it's actually the mucosal areas that tend to store a lot of the infection and be drivers for infection and inflammation. So that's why that mucus gland is really important there. Here's the thymus. This is a controller for the immune system, and there we go. We can see that it's working hard. It's working on some infections right now, most likely. Let's look at that lymphatic, and again, we see that lymphatic system struggling to drain through that jaw, dental, sinus region. And that's what's nice is you can track your drainage. You can see where it's having issues, and then you can address it accordingly. Look at this lymphatic. I definitely expected this, knowing her lung issues and respiratory infections she chronically gets. So there we go. That is the basic and scan portion of this. I'm going to pause for just a moment. Okay, I'm back. I just needed to change the screen and alter some privacy information for Jen. Let's go ahead and start digging in for a little bit of analysis. The first place that I start is actually in the biofield, where I'm able to go into my advanced analysis and run a quick little pathology on the body to see things that are most prominent for her body today. So partially we have some anxiety, some bone. We have some hemorrhoid issues, hypothyroidism, and then we're seeing this come into play with a lot of that inflammation going on. with that tonsil and lung area. We're seeing that dotted through here. We're also seeing some gallbladder dysfunction, some breast inflammation, which we actually saw on one of our cross sections in the first general scan. A little bit of an ovarian cyst going along with a little bit of urethral irritation. And then we see the thyroid coming into play twice here with the hypothyroidism and the goiter here. Dysautonomia, and I know her, this is very accurate. And then some varicose veins and some more dysfunction for the colon. So we have a few things coming up here for dysfunction of the gastrointestinal system. None of this is designed to diagnose, but it does help us have indicators of the different problem areas in the body. And so we can brainstorm ways to support that. Jen, has everything been accurate so far for what we've seen?
Very.
Okay, all right. I'm not surprised. I do this all the time, and this is a pretty awesome machine. So the first thing that I'm going to do is we're going to be working on that respiratory system. I'm going to show you how to do an assessment. This COD column has to do with how much overall energy is within a system. So I'm going to filter that COD column to anything that's less than or equal to 1.2. So everything in this column, these represent organs that are losing their inherent ability to adapt and heal themselves. When they are like that, that means that the normal therapy, or normal biofeedback balancing isn't going to be sufficient. They need additional resources added to the body in order to strengthen them. So when I'm running across something that has lower energy, then those are the areas where I'm going to start doing some advanced therapy work. So I'm going to take a cruise through here and find some of our lowest energy points. So one of the lowest energy points is the red blood cells. I can go into the red blood cells and do advanced analysis. The pathology there isn't going to be accurate, so I don't do that screen there. But what I do is I do go into my database for detox no-sode hints. This helps me find the root cause of things that are wearing it out, and I put on a digital filter. So allergy, I always take the top 3 as my most relevant. So body clock would be our endocrine system. Post-virus is getting over an infection, which she has frequently, and then allergy. Down here we see detox and maybe some virus that we would address. So the first thing that I would actually do is I want to go ahead and take a look at how this corrects with normal therapy. So I'm going to go do a normal biofeedback therapy. I'll run on it. We're going to do 3 swipes through of that, and we're going to see that if there's any correction that takes place. My goal is to get between 15 and 35% correction in an organ, but in this case, we're probably not. We only got 6%, and that's because that area is worn out. These blood cells are tired. So when I have something tired, now we're going to go and use what we learned in our advanced database, and we're going to go find a remedy for it. So here we have allergy remedies. I'm going to apply some digital filters, and then I'm going to start doing a test sample of an allergy remedy on her body. So I'm going to go here. I'm going to do a transfer into her body and see what happens. So with doing an allergy remedy, I actually was able to get 12% strengthening, double the amount that I got through a normal biofeedback. So once I find a therapy, then I have the ability to send the signal of that therapy either to her or program a homeopathic substance. There we go. Now I'm going to pop out of here and I'm going to grab a fresh sample of that red blood cell. I'm going to go back in and I'm going to try Bach flowers. The reason why is because that body clock, our endocrine system, showed up. And the Bach flowers, people think of them as emotional remedies, but they actually are also remedies for endocrine dysfunction. So with applying that oak Bach flour to her body, we were able to get now another change of 16%. So now I actually hit my target too, because remember, 15 to 35% is considered a good shift. So I'm going to go ahead. Now that I verified that that works for her body, I'm sending that sample to her. And that's what's great, is that with this advanced panel, everything in red is something that would be good for her. But I am able to verify that her body is ready to accept it, and being able to verify that first helps me avoid a healing crisis or forcing things on her body that she's just not ready for yet. The other thing that we're going to work on is going to be this lymphatic system. Let's see, there was a tired portion of the lymphatic right here. So when with normal biofeedback therapy, we only had a very small change happen when it did that. So let's go into our advanced analysis here. I'm going to go into my detox no-sode hints because I want to learn about what's stressing. So there is a virus that's currently stressing, and part of it's endocrine. So what I'm going to do is I'm actually going to go ahead and let's go into the homeopathics this time. In my homeopathics, I'm going to do a few digital filters, see if anything pops. Nothing's popping in red for her here. So now I'm going to try organo preparations to see what body parts or body systems would be supportive where I can send a healthy signal to that lymphatic. So it's actually a type of cervical lymph node that is registering as being most needed by this lymphatic system. And by applying that lymph node, we were able to get strengthening of 13%. So I'm going to actually go ahead and apply that to her body. I know we didn't reach our target of 15%, but this lymphatic system is a very kind of set in its ways. You can tell by how it looks in the general energy readings. So I'm going to be happy with even some of these small changes. I'm going to scroll through, see what else I see on here that needs to be adjusted. There's actually quite a few things, but I'm going to try to use our time wisely. Let's go to the thymus. Let's do an advanced analysis and see what's stressing out this important controller of the immune system. Nothing popping in red, but virus is still there at the top. So in another session, we'd probably want to focus on microorganisms. In the meantime, let's look at homeopathic to see what it wants in support. Our metallicum is the top one that's coming into play. And that's also a good one for anxiety. And remember, anxiety was something we found in the pathology, but our metallicum does quite a lot. You see that the list of things here is extensive, which is how homeopathics work. So I bet if we went through that, we would find that a lot of it resonated with her. Doing that application of the homeopathic strengthened that thymus by 59%, which is a huge change. So we're going to go ahead and take that remedy and we're going to apply that to her. So this is a sample of what a 15-minute session looks like. Although ideally I'd be moving a little bit faster and not juggling Zoom. And this is a lot of information that we can get. And this is an endless, honestly, analysis that we can do. I have a lot of different databases that will give us a variety of information. I can even look at the blood chemical homeostasis and run an analysis on that to see what levels are high and low in her blood system, as well as being able to look at the hair metals to see what metal toxicities are going on. It's really a rather extensive set of databases here with every single one of these coming into play. So I hope you enjoyed. That was our short little demonstration of this machine.